survey? Anybody know anything at all about magnet? I know Ellen does, she's raised her hand. So I'm briefly going to tell you what magnet is and what it means to everybody. It's not just for nursing. So magnet is the highest credential. Oh, I'll start to walk when I talk. Magnet is the highest credential for nursing excellence that exists in the whole United States. Every 4 years, we recertify as a magnet hospital. Riverview first certified in 1998, and we are recertifying again in the year of 2022. So that's, wow, 24 years we've been certified for magnet. Only 10% of the hospitals in the country have magnet designation, and only 10% of those have certified 4 or more times. So we are in very elite company here at Riverview, having certified for magnet. If you look at the magnet model, this pretty much describes what magnet's all about. And as I said, although magnet is for nursing, we know that nurses work in a group, we all work together. And so everybody, when our magnet surveyors come, will work together and talk to the magnet surveyors. You'll actually get a health stream probably in January that talks a little bit more about magnet and tells you how we all work together to make patient outcomes better. So it's not a fluffy designation. One of the best things about magnet is that it's serious. There's a lot of data. And you guys have a couple of projects actually that go along. And I'm going to show you the 2 projects that are magnet projects that came from 5 North. Yay. So here's the things about magnet. What do we talk about? So empirical outcomes, that's what I just talked about. We have data-driven projects. We make ourselves get better and show good patient outcomes. So it's back in the 1998, magnet was, I think Nurse Trish is the best, signed Mayor of Red Bank. So there was a lot of letters that said, oh, these people are wonderful. Now it's all about data and it's all about comparing ourselves to national benchmarks, just like your CARF, right? You're comparing yourselves to national benchmarks. And that's what magnet is doing with us. So structural empowerment means, do nurses here at Riverview participate? I gotta take it. I'm really sorry, I can't talk. Thank you. Participate in having support for education, just like everybody does. Are you supported for education? Are you supported with tuition reimbursement? Are you supported with in-servicing and programs like your CARF fair to help you get better at what you do? Structural empowerment. Let's see what else. I'm going to go to the cheat sheet over here that somebody made for me. Cheat sheet. Okay. Residency program, community involvement, Nurses Week. We celebrate certified nurses. We give out scholarships for nurses. So those are all parts of structural empowerment. Exemplary professional practice. That's where all the data stuff lives. So that's where we talk about the CAUTI, the CLABSI, the falls with injury. And HAPPY goes into exemplary professional practice. Also, patient satisfaction goes in there, and anything that's about really doing your job well. So we write stories about all of these things. New knowledge and innovation, that's where we determine that even though we're a little hospital, small to medium hospital, we use innovation in our practice. So we have to write stories that demonstrate, for example, the cath lab, the new thing that they use to occlude the artery, or in the emergency room, how they use the after visit summary, or in the women's center, how they rearrange their workflow to make patients more on time for their procedures. And then transformational leadership. We got one in the room right here, right now. We have Kathy Puso. So are we showing everybody that we have transformational leadership? Do our leaders support us? Do they guide us? They provide the best example they can for us? And that's what magnet's all about. And very funny, I was always like, what's this global issue thing around here? What's this ring around the magnet? I have no idea what that means. Well, guess what? It's COVID. It's COVID all over again in the Delta variant. It's nurses helping going to Haiti, like Florence Germain. I think about Florence Germain, you know. So she went and she helped in Haiti after the terrible hurricane that they had. So you pretty much have everything wrapped up in here in the magnet model. So let me put you on the timeline for magnet. So all these things that we wrote about are in the book of magnet. And we just submitted the book of Magnet on October 1st, and there's 94 chapters in the book. Everything that we wrote about how wonderful we are at Riverview, nurses and the whole interdisciplinary team. They are reading the book and they're sitting in the recliner, I guess, and taking their time, because we won't hear anything from them until probably last bit of December. When we hear from them and they say, we love the book, we're going to come and do a survey, we have 40 days of public notice that we have to wait out, because you have to put up signs for the public saying, this institution has applied for Magnet status. And anybody in the public who wants to give comment has 40-day comment period. So we have to wait that out. So most likely time for Magnet to come is late February, or even more likely sometime in March. But we will be ready when they come. We'll be having Magnet fairs. We'll be having a Magnet education on Health Stream. Jessica Evans is your Magnet champion, so she'll be doing all kinds of things with you. She's got a quality board to hang. She's got a brag book that she's going to be taking around that showcases everything that we do. I think of this as like the sun in the sky, right? Because I talk about this Magnet model up here, and it doesn't really click home until we start talking about the stories that go along with it. So let me tell you the stories. You guys are way ahead of everybody else. You already have 2 Magnet stories from 5 North, and the first one, and Jessica wrote about Linda Matthias's advocacy for a wheelchair scale. So Magnet tells you what they want you to write in the book of Magnet, and they asked for a story that told about a nurse manager's advocacy to make something better for her patients. So back in, I'm not sure exactly when, oh yeah, January or February of 2018, nutrition was working with the team on 5 North, and only 22% of the patients were getting weighed on admission. So they looked at it over and over again. Oh, all right, we're going to encourage you. You're going to zero the beds. We're going to do this. And they got up to 60% or 66%, and they couldn't get any higher. He said, what's the barrier? Well, there were several barriers. First was that only 2/3 of the beds had scales. So if the census was high, they couldn't weigh everybody on a bed scale. So that was out. The second one was they didn't want to move the patients before they had a physical therapy evaluation. I think that's one of your baselines. Does that sound about right to you? That physical therapy has to evaluate the patients? Yeah. Yeah. So that was the barrier, that they didn't want to get the patients standing or moving until they had a physical therapy evaluation. So they identified those barriers, why they couldn't do any better. And Linda said, I'm going to do a foundation grant for a wheelchair scale. And that was how your wheelchair scale came to be. Because Linda reached out, she advocated, because she said, we're not going to get above 60% or 66% because we don't have the tools between the beds and the lack of the therapy evaluation. So we're going to get a wheelchair scale. So by having the wheelchair scale, your weights went up to 84% as of March 2019. So Magnet's a moment in time, right? So you say, well, why are you writing about 2018 and 2019? Well, that's when this happened. And it's another example of what a great job you guys do. So that's all about Magnet. The next Magnet story is the interprofessional collaboration on 5 North. So this one is for everyone. And so this took place, a story that took place when, let's see, the second quarter of 2018. And here's everybody who was on the team: Megan Marino, Jamie Gelke, Linda, Megan Van Schaak, Joanne Watson, Wendy Moore, Amy Flanagan, Jackie Matthias, Ellen Adario, Julia Zabrowski, and Jennifer Dunn. Everybody on the team. And so you would see here from our empirical outcomes from our data that you had a couple of quarters where you had falls with injury. Not so good, okay? So you set out to make things better. So here's the intervention, which was between the third quarter of 2018 and the first quarter of 2019. And this is all the things that the team did together to make sure that you put all the pieces together to make that rate of falls go from here down to here. So pretty good work. I understand people were walking around testing socks. Was there any sock testers in the group here? Yeah, the sock tester, right? Right. So you walked around with socks. That was the time of Stay With Me, I think when Stay With Me came to town, right? Staying with the patients in the bathroom, and fall events were reviewed weekly. And one of the big things that came out of this was the overconfidence falls, that the patients who came back after therapy were filled with overconfidence. I just had a great therapy session. I'm going to get up by myself. Because they looked at all the falls, they looked at the time of day, and immediately post-therapy was a high fall risk time specific for you guys. That's what we always talk about, right? Is making your risks, your intervention specific to your area. So from that grew better communication and a mini handoff after therapy to make sure that everybody was on the same page. Patients back from therapy, everybody talk to the patient, see what they need, see if they need the bathroom, kind of recheck them in and emphasize the restrictions that they have. And it took the overconfidence falls down out of the mix. So the reason we talk about this is because it takes a village. It took everybody and all the parts and pieces working together to decrease the falls. And that's what Magnet's all about. So when the Magnet surveyors come to town, they will like to stop and talk to everybody. And they'll say, tell me about working on the floor. Tell me how you take care of patients. Tell me what's different about your unit. So I always say the Magnet surveyors, there'll be 3 nice ladies here for 3 days. And they're like your grandmother. So they want you to do really well. And they say, oh, Julia, what a nice story that was. What are you working on now? Right? So they're super nice, but they always want to know that you're moving on to the next thing in a culture of continuous excellence. That's it about Magnet. So I hope you get all excited, and I hope you're happy to see them when they come. It's a nice survey. We have to be ready for it, but it's a warm, nice survey. So don't be scared. Anybody have any other questions about Magnet?